Hello everyone. In this video, we are going to see about AIIMS NORCET 6 paper solution. More than 50 MCQs which we have got in our exam. So we can see here, first one. Patient came to emergency with cardiac arrest. What is the nursing priority of action? In that options were head tilt, chin lift and jaw thrust maneuver. So answer is head tilt, chin lift. Why jaw thrust maneuver is preferred over head tilt chin lift maneuver? So it helps to prevent from neck injuries. Next one, child is on CPAP and child is hemodynamically stable. So what type of feeding can be given, like tube feeding, breastfeeding, IV fluids and cup feeding? So for the child who is on CPAP, breastfeeding can be given. We have got the image Venturi mask. What is the FiO2 of Venturi mask, which is in red in color? So 40% is the answer. Next one, within how much time the blood has to be transfused to the patient after taken from the refrigerator? 15 minutes, 30 minutes, 2 hours, 3 hours. So the answer is 30 minutes. So we have got in section 5 Duncan Passage. So it is located in Andaman and Nicobar Island. Next one, nasogastric feeding. So when you are giving any medication, with how much ml of water we need to give? That is either 20 to 30 ml, 5 to 10 ml, 10 to 15 ml or 30 to 50 ml, and the answer is 10 to 15 ml. CPR compressions ratio was asked. It is not asked for either adult or baby. So the answer is 30:2. What is the ECG findings of calcium less than 7 mg per dl? So hypocalcemia. So in this, peaked T wave, prominent U wave, prolonged QT interval, ST segment elevation. So the answer is prolonged QT interval. Next one, kerosene poisoning in child. So what can be done for the kerosene poisoning in the child? Over 2 years. So activated charcoal, keeping for NPO until help arrives, or any induced vomiting. So activated charcoal can be given, and in some cases we can induce vomiting to the child. A female with a breast lump which is firm and mobile. So what is the next nursing action is? A, physical examination, B, FNAC, breast ultrasound and mammography. So breast ultrasound is the answer. Next one, nursing action for right side mastectomy. So what can be done is taking blood pressure in the left arm. Then pH 7.25, PaCO2 40, HCO3 22. So it is the metabolic acidosis. Next one, when EMLA cream is applied before procedure, either it is before 10 minutes, 60 minutes, 2 hours or 3 hours, and the answer is 60 minutes. What to do when granules are found in DPT vaccine vial? A, discard the vial. B, shake the vial and give vaccine. Keep aside to allow the granules to settle down, and the option is discard the vial. Next one, female with 32 weeks gestation came to emergency with vaginal bleeding, tender uterus on palpation. What does it suggest? It suggests placental abruption. How to secure ET tube to prevent bedsore? Answer is cheek to cheek above ear. Next one, CA 125 is elevated in ovarian cancer. Next, client came to hospital with RTA. What type of oxygen is administered to the patient? So mainly paper bag breath can be given. Next one, injection sustained 100 mg is given by IM injection in Z-track method. Next, ET tube 4 mm. Then what is the suction catheter size? We know 8 French. Next one, nursing action when patient has respiratory distress during suctioning. So when patient is having respiratory distress, what we have to do? Withdraw the suction tube. Trans elimination is done before venipuncture. Action of furosemide in right-sided heart failure. So it will reduce the edema and it increases the flow of urine. Next one, Gödel's airway measurement. How to measure is tip of the nose to the lower earlobe. Next one, least leakage is seen in which type of oxygen mask? That is face mask. Contraindication of NG suctioning, that is mainly basal skull fracture. Hypokalemia occurs in nasogastric suctioning. After blood transfusion, circulation overload is seen by tachycardia and distended neck veins. In second and third degree burn, how do we assess fluid balance? Mainly IO chart monitoring. Extravasation at IV site can be due to which type of injection is phenytoin injection. Poor circulation in child is seen by fast breathing. Then complication of hyperventilation, pneumothorax. CTG, cardiotocography was given. The answer is late deceleration. In child receiving chemotherapy, what are the infection protocols, infection prevention protocols except is SIDS bath. Then complication of hyperventilation pneumothorax, it is repeated. Then image of forceps was given, it is valcellum. Hyponatremia, first symptom is thirst. When the child is having diarrhea with sunken eyes and rapid breathing, what type of dehydration is? It is moderate type of dehydration. Colostomy care for 5-year child is keeping the colostomy area clean and dry. How many liters of oxygen delivered for shortness of breath and wheezing? Mainly asthma patient. So it is up to 4 to 6 liters. In option 5 liters was mentioned. Then term baby's Apgar score is 7 and we can see the mouth is stained with meconium secretion. So what is the nursing action? So as secretions are found, we need to suction the secretions. So how to identify the patient before any drug administration? So we need to ask patient's full name, date of birth, and we need to cross check with the name on the drug chart and ID band. Mr. X complains of pain in the calf muscle since yesterday, and here what he is telling about the pain is location, intensity and duration. Patient came to the hospital with fever, had hospital acquired infection. So when they are having hospital acquired infection, patient has developed a fever. So when the information should be given to the client? So it should be given on second day of infection. What is the use of zinc in diarrhea for children? So it will reduce the number of stools. Thrombocytopenia question was asked. So due to thrombocytopenia, what happens to the skin? So we can see bruising over the skin. Temperature 104 degree Fahrenheit and the pulse is 110 beats per minute and respiration is 30 breaths per minute. What is the nursing priority or nursing action? Among this, what is the priority? So fever, that is temperature 104 degree. According to WHO, second stage of labor when we have to do is when there is a complete cervical dilatation. Then in section 5 question was asked about adept synonym, that is very skillful. The next one, pleasant is said to be palatable. Next, genius in computer of mathematics, Shakuntala Devi. Most of us has written Ramanujam, but in computer of mathematics it is Shakuntala Devi. Next one, antonym of monarch, that is republic. Next, group of crows are called murder. Then COVID-19 is announced as public health emergency on 30 January 2020. So these are about almost 55 questions. In the previous video, when you go to this channel, you will find other 10 questions. So if you find it is helpful, please like, share and subscribe my channel. Thank you.